This video will demonstrate how to transfer a neuro patient from lying to sitting, towards their unaffected side. The therapist starts by introducing herself and explaining the transfer, and then adjusts the bed to ensure correct height according to back protection principles. The therapist starts by rolling the patient towards them, to their unaffected side, using the correct rolling technique as shown in previous videos. Once the patient is in a side-lying position, the therapist places one hand behind the patient's knees to scoop the legs off the bed by flexing the patient's hips, while her other hand remains on the patient's shoulder to maintain stability. The therapist then places one hand under the patient's unaffected shoulder, careful not to put pressure on the neck area, and her other hand on the patient's hip bone, lifting the shoulder and pushing through the hip at the same time to bring the patient into a seated position. Both of the patient's hands are placed on the bed next to her for support in balance. The bed height is adjusted to be appropriate for the patient's height, and the patient's buttocks is shifted forwards so that her feet are flat on the ground to ensure stability, with one hand placed on the patient's shoulder at all times to maintain balance and prevent falls.